Hey, welcome to HTM Insider. We're glad to have you back, along with our guest today, Reamer of McLaren Health. So excited to have him on. We had a conversation last week that I just can't wait to share this with you guys. It's a new thought, a new way of doing business in the hospital. And so with no further ado, I'd like to introduce you to my new friend, Rich. Rich, tell us a little bit about yourself.
Well, thank you. Hopefully I won't go long. It's a boring story. I've been doing this for 30 years in this business. So I've been all over the place, been in the um, ISO business and been in the manufacturer side of things. And now I find myself in McLaren Health Care as an in-house regional manager for clinical engineering. Uh, it's been a lot of fun. It's been a lot of challenges over the years, as you can imagine, but I survived, and here I am.
That sounds like an amazing career. So for those that don't know, where is McLaren Health? Where are you out of?
McLaren is based out of Grand Blanc, Michigan, and we have 15 hospitals that are all over the state of Michigan, and also we have a hospital in Ohio. So we're multi-state now, and the hospital that we'll be kind of discussing the achievements is located in Petoskey, Michigan, which is way up at the tip of the Lower Peninsula and a beautiful area.
So I saw an article about the team that you're mentioning and what has happened there. And once I saw that, I knew I had to reach out because I thought it was new, it was innovative. And I know our listeners are always looking for that new idea, maybe that they could adopt into their hospital systems. So why don't you tell everyone about ERCI? What is it?
Well, ECRI is the ECRI Institute. They handle all of the recalls and alerts throughout, our medical industry. Very big name, international name. And they had a opportunity for us to apply to an award that they give out, and it's the Health Technology Excellence Award. And didn't realize how big of a deal it was until we actually got into the process. And there were 5 nations actually applied for this award, and we were selected. So it's been an amazing journey. And, I can't speak highly enough of how professional they've been and through this process of getting us to where we are, and the amount of press and other things that they've actually provided, and shown our efforts to potentially the world, which is pretty awesome.
It is. It's quite the accomplishment when you start to look into it. So let's just dive right in. So, were you laying in bed one night and you had a new idea, or how did it all come about?
Well, getting started with what we built at Northern Michigan is really years in the making. And, we
And
went
it's like a
through.
construction project. Wasn't there something?
Yeah, we were knee deep into the construction project, and we were going through the planning process, meeting with the architects and all this other stuff. And, leadership, myself, and, also clinical engineering leadership, we really wanted to get into a position where we weren't just building a space. We were building the future. How everybody says the future of healthcare. We truly wanted something that was going to be somewhat future proof, and get it to the point where we have the best system that we could potentially have. Obviously money's a factor, and we had to get that figured out. But we have a fantastic foundation up there that found us some money, which is fantastic. We were able to accomplish really everything that we set out to do. And initially, trying to bring 9 different vendors together and coordinate that effort. The initial part of it is just, how do you bridge the gap between all these vendors that want to provide their system and all of their system? They didn't want to just provide what they're the best at. They wanted to provide everything that they thought they were good at as well. but not everybody builds the best of everything. So we went through the process to actually invite all of them to a single room, which they thought they were coming to a, kind of like a dog and pony show where they were just going to show what they had to offer and not necessarily talk with other people that provide either competing or, systems that would complement their system. So it was really interesting when we invited all these folks along and they all showed up to the boardroom and we kind of sprang it on them. There was a lot of looking around the room, a little bit of nervousness, sales and their tech teams were there and nobody really knew what was happening except for our side.
I love it. I can imagine they all kind of thought they were showing up as some type of value analysis or going to pitch their product. And we were talking the other day, I thought it was pretty interesting when you said, we're going to have to learn how to work together, right?
Right. And, initially when they come in the room and I started talking, there was just silence. You could hear a pin drop and they were just not willing to open for this conversation. But after the awkwardness faded, one of the vendors just grabbed a hold and started saying, hey, if I send you this, you can send me that. We can share this information. And it was a process. And they all started opening up to the idea of what we were actually going after. Because we asked them, what would it look like if you worked with your counterparts in this room to build the best integrated system for us? What would it look like? What would it take to get us there? And I'd have to say, years after that meeting, we came to a really good spot. And, we have probably 95% of everything we were looking for working. We're delivering it in phases to the end user because there's so much information. We want to make sure we're not overwhelming. We're not creating an environment where they're like, okay, turn that off. I don't need this much information. But we've seen amazing results with some of the systems that are currently in there working. And, just the numbers that we're seeing for some of the safety events that could have, not necessarily would have gone missed, but there's so much that was captured and created an opportunity for staff to actually create a safer environment. And it's working and we're really excited about it.
So let's just talk about a few things. Let's start with the patient's room. So what have you done differently and how's it working out for you?
The patient room is very, very well integrated. We have beds that talk to whiteboards. We have
what does that mean? What's a bed that talks to a whiteboard? I haven't seen it.
Yeah, well, we'll dive into that. Initially, we wanted to have smart beds, beds that did more than just have patients, sleeping in or being cared for in. So we went to Stryker and said, hey, what do you have in this environment? They provided a wireless bed that actually communicates out all of its settings, all of its parameters. And while we were looking at that bed, we found the MediSign whiteboard, which was not on the initial list. It was something that we found and we're like, we have to have that because the bed actually directly wirelessly connects to that whiteboard and it does some pretty amazing things.
So you mean it's replacing that board in the room. They write in Nurse Nancy, 8 at 7 a.m., medication at this time. It replaces all that.
It does. It reduces the frustration of the staff for keeping up with the board. And it also creates an environment where the patient knows really what's happening. And it's actually directly connected to our electronic medical record, which is Cerner. And Cerner updates a lot of that board automatically by sending information to MediSign. So, it comes right out of the nurse's hands, goes directly into an automated process. But there are situations where the nursing staff and the caregivers can actually leave notes electronically on the board from their nurse station or from their wild card. They can log in and leave a note for the patient or the family members. It's a really unique situation. But back to the bed sending the info, if the patient is a fall risk, and this is where the safety really comes in, if the patient is deemed to be a fall risk, then the bed is set up appropriately for that patient. And the fall is set within the bed, but the bed is now configured at a point, side rails up, head of the bed at the right angle, brakes are set, the alarms are set, and that's all displayed on the MediSign. And if the patient happens, it is. And if the patient happens to exit or begin to exit the bed and the alarm goes off, the board doesn't just sit there and say, okay, there's an alarm going off. It actually gets involved with the process by changing its state and changing to this great big obnoxious board that says, please get back in bed, your caregiver is coming. And it doesn't just change into a physical look. It actually changes and actually audibly says in the patient's native language, it says, please get back in bed, your caregiver is coming. So it's really a cool system, and not just in the room, but the whiteboard is actually posted outside the door. So you have you don't have all these sticky notes or magnet cards or flip indicators or anything like that on the door anymore. It is the electronic whiteboard that delivers the information about the patient in the room. And, so it takes it to that next level. And then on the nurse's station, the whiteboard is also there and provides all of the same information that the other two boards provide in more of a streamlined approach. And it gives you exactly what the patient is doing. It'll show they're either out of bed or the brakes aren't set or it's not properly, built. So people can go take action on that. And it's just a great, great system.
That's amazing. Now, are your rooms, are they all private rooms, or do you have semi-private rooms? And how is that addressed?
We do have, currently in the new space, it's all private. We will have some semi-private rooms in the existing space, but it will be a small number, and we'll only use them as a semi-private when we have to, extend our bed capacity a little bit.
So I wanted to ask that question because you and I talked about something else, which was totally amazing. Talk about the interaction with the nurse and the patient in the room, right?
Well, we have a hands-free communication style, which is provided through Vocera, hands-free badge. So there's no touching of the badge and then going to wash your hands because you've dealt with other patients. It's completely hands-free. And obviously through the last couple of years, everybody's looking for infection prevention that is beyond this world. So we went with this hands-free, but it also, the staff will be wearing, and this is a system we haven't turned on yet. They will be wearing, the hospital's wired for this, wearing another badge that actually gives location of that caregiver. And it communicates that information back to Vocera, communicates that information back to the nurse call system. So as the caregiver enters the room, if the patient has an alarm situation, the caregiver enters the room and the alarm will be canceled automatically without touching anything because of the badge, because the system knows that that person is entering the room and going to take care of that issue. And on top of that, because they're wearing this location badge, it's associated with that caregiver and only that caregiver. So now we have the opportunity to introduce that caregiver to the patient by displaying the caregiver's information and their picture on the MediSign. So as they enter the room, the system recognizes them and it posts a picture of them on that whiteboard.
That's awesome.
Yeah, it's a constant reminder of your care team, gives a better recognition. People that have, some memory loss situations, potentially, they will see their face on that board and they'll know that they belong in that room. Maybe they forgot who they were, but they will know that they belong there.
I think that your patient satisfaction surveys have gone up.
Yeah, Well, and the view definitely helps with that. We have a phenomenal view of the bay. So that definitely helps, but also all of this integration and the fact that they know we've invested in their stay to this level. And also we even thought of the patient as far as entertainment goes. You're laying in that bed for, days on end potentially, and you're gonna, I know I would lose my mind laying there. So, if you're stuck in that situation, you need something to relieve you and help you find a better state of mind. So we looked at a system called Kerbal Rego, and also telehealth IPTV. And the Rego device is a handheld pillow speaker with a touch screen built into it. And it allows for, surfing the net, doing FaceTime, Facebook, whatever social media you have. They can log into their email. They can check their, the status of their family if they're not able to visit. And it's really opened the opportunity for them to still be connected to the outside world. And, even though they're in the hospital. But it also provides education for their condition. It provides a link to a virtual nurse that is actually present through the television and it's called the Banyan Bridge, that their system sits on top of the TV. It has a built-in microphone speaker, and it's basically a computer condensed down. It has a video camera, and the patient can see the nurse on the TV, and the nurse can see the patient via the camera. The camera can tilt, pan, zoom, all that. So they truly are another set of eyes in the room, and the patient is connected to a nurse pretty much anytime they want them. It's a phenomenal system. And, they can pull up test results. They can share images from radiology or any tests that they've had done. They can actually work with the doctor. So if the doctor enters the room, he can actually call up the virtual nurse and have the information shared that way. So if there was a test result that they're waiting for, they could actually put it right there on the screen. So it's just so much easier to have the data available and have someone on the other end being able to gather it for you and then display it. So yeah, that's pretty exciting. And then they're connected with the telehealth, the IPTV. So everything is able to be sent directly to that patient. It's not like it's, your standard cable. Everything is sent directly to that patient for their care or for their entertainment. And it's all customizable.
I mean, that's just great. If I had to be a patient, I'm going to fly to Michigan and come stay in your hospital. So what else is going on? Like you said, you held some stuff back, right? I think you have some, RF capabilities. You have a lot of other things that are going on. So what are you holding back on, and what else is outside the patient room that you guys worked on?
Well, we're holding back on the Rtls, and that's because there's just so much more information that will be coming into that situation. Knowing where the nurse is, knowing where the equipment is, and using that system, and then advancing the communication off of that system. The escalations can change drastically when we turn that on, because Vocera can handle sending the appropriate staff to a situation, depending on their location or depending on if they're in a patient room. All of that can factor in and make a more efficient process. You won't have somebody running from the other side of the department to enter the room to help out. It will really be pinpointed and more efficient. So that's something we haven't turned on yet. And looking forward to that. We had conversations about that today. So we're very excited about that.
Very exciting.
Yes. And, we didn't leave the OR out of our integrations and things like that. We've got Olympus and Stryker working together for a complete 4K integration. So we have the highest quality video imaging for the equipment down there. So the doctors are pretty pleased about that, I'm sure. And we also have the capability of sharing video live stream from the OR to any system within our system that compares to the Olympus, and we have that at two of our other facilities right now, and we're looking to move that into more. So we can share teaching moments, and we can also share across specialties. So we didn't want to leave the OR out of this at all.
What about that ER, that place where everybody goes when everything's gone wrong, right?
Yeah, the ER is our next phase. We're looking to get the MediSign in there, and also link that up to our call system, of course, and have that same functionality that we do in the patient areas. So that will be the next phases is that as well. They already have the Vocera system, so they're speaking hands-free, which definitely helps in the ED. But some of the other systems have not been put in there, and some of it is due to spacing outside doorways. ED is a lot tighter space, and we don't always have the real estate to put things in. So there's a little bit of a challenge as far as that goes.
How's your team, clinical engineering, responding to all this, and how is the rest of the staff responding?
Well, clinical engineering, of course, there's a learning curve on all of this. Everybody's wondering who owns it once it's in place. We've worked directly with IT. We have a great IT department. We've shared whose responsibility it is for certain aspects of this. So it's new territory. It's not like this is, an IV pump. It's not an IV pump. We've got a lot of different ways of looking at the system or getting it corrected if there's a failure. And my team's been very involved doing all the testing of each system as they come online, and making sure that they're communicating across the other systems as well. And IT has also been doing that same thing. So it's been very cross-functional, and we've collaborated very well.
And the rest of the hospital staff, so your end users, what are they thinking about it?
The end user is pleased, and obviously learning curve, and through our COVID days, there's been a lot of staff change and turnover. So our education department has been phenomenal on making sure as people are onboarded, they get spun up on all this new technology, so that nothing slips through the cracks and we don't end up losing some of our advancements through lack of knowledge. Because if time goes by and you don't use it, you're just going to think, why bother? It's not useful. But there's a lot of useful information that's being shared. So the end users are very pleased with the system. And obviously, because we installed everything in the new space, we haven't retrofitted the existing space as much as we were hoping to at this point. Construction is what it is. So, they look at each space like this is massive on this side. We have all this technology. When are we going to get it over here? So there's a drive to get it. We're working diligently on making it happen. And, just the actual safety that's been provided to the patient through some of these systems working together, especially the Stryker and MediSign. There's been literally 1 million safety catches, and they're not like life-threatening safety catches, but they're all moments in time. And this is just from August, from
Wow.
we went live. So this is August till now. There's been over 1 million catches, and some of them have been fixed in 3 seconds, and some of them taken, minutes, but they've all been captured and they've all been corrected. So you just look at that total number of incidents that could have gone unnoticed under the old system until potentially something happened to bring it to your attention, or the next time a patient is visited by the nurse. You just look at it in that respect. Our already low fall numbers are being impacted by this system. and we'll just take that as a win for everyone.
Oh, no, that's great. I mean, anything we could do in the hospital to promote better patient safety and patient care, I think is a win-win, right?
Mhm.
People heal better when they're taken care of. And I think this system is helping people feel taken care of.
Right. Yeah. If they're happy in the environment, or at least comfortable, then that definitely aids in the whole process.
So now that you have one hospital done, is this a plan to execute it over the entire system, or is it going to be a slower process?
Um, it will be a little bit slower, because Northern is just one of those places that the foundation says, "Oh, you need that? Let me go out and find the money for you," and they come through. So we are very fortunate as far as that goes. Other hospitals have collected and used some of the systems, not all. So the Vocera thing is going to be pretty much network wide. MediSign's being put in place, and it is in place in one of our other facilities. There's interest in it at one of my other facilities, and just looking at this as a whole, there's a lot of money that has to be spent in order for it to be 100% like what's at Northern. But McLaren's commitment is it's part of our slogan. We're going to do what's best. And doing what's best is looking at the tech and making sure that it fits with, the operation of that particular facility. And if it makes sense, we're going to go forward with it.
I mean, I love it. I love our chat today. And we're going to wrap this up, but I want to ask you, we always ask every guest at the end, what is your words of wisdom? What can we leave with the audience, maybe about this experience or your experiences in general over your longevity of your career? What would you like to leave the listeners with?
Just stay alert. There's so much happening in healthcare right now. Some of it is super challenging, but if you stay alert to what's available out there, it will allow you to better guide. And that's what I feel our job is in healthcare technology, is to guide the facility in the direction of the newer tech to help with the situations we find ourselves in.
That's awesome. I really like that. Stay alert, head on a swivel. I mean, it's a good model for life, right?
Right.
Well, thanks y'all for tuning in again today. Again, my name is Sherelle of Multi Medical Systems and Rich Reamer with McLaren Health. And we'll post your contact information. Maybe there's somebody out there who wants to learn more, and I'm sure you'd be happy to share.
Absolutely.
Thank you all for tuning in. And, you can find us on Spotify, iTunes. Check out our website at multimedicalsystems.com, where you can find all the episodes on HTM Insider. Thanks again, Rich, and everyone have a great day.